Serving all of San Diego, this is your Fox 5 News.
We have a few guests with us this morning, and we're talking about a subject that not too many people talk about very often. So about 30% of younger women are experiencing sexual pain, and they're suffering in silence, but there is help available. So we've got Dr. Irwin Goldstein, the director of San Diego Sexual Medicine at Alvarado Hospital. He's here with his patient, Lauren. All right, so Lauren, we're going to start with you and talk about when you decided to seek treatment, and how did you find Dr. Goldstein?
It was a long path to finding Dr. Goldstein because a lot of people are misinformed, even in the medical field. So I just made a decision that it was something that was important to me, and I had to keep pursuing. And I'm so glad I did, because it was a really, really, really long journey to finding someone that knew what to do, and that, you know, made me a whole new person in getting those problems addressed.
Right. I mean, we're talking surgeries. We're talking about some serious operations and things that you're going to have to, procedures that you have to have done so that you can be the new you. We're looking forward to a new year, Dr. Goldstein, and, you know, whether it's a fitness regimen, a health regimen, or maybe in the bedroom, that's kind of what we're talking about here, is starting out and being able to be a new you. Can you talk about some of these procedures and Lauren's case, what happened there?
So Heather, first, thank you for allowing sexual medicine on TV. It's fabulous that you guys do that in Fox 5. We love you guys. You shouldn't have sexual problems at all, but you're allowed to have sexual problems when you're older, but you shouldn't really have sexual problems as a younger person, especially a younger woman. It affects you in so many different ways. You need specific diagnoses, and then based on the diagnoses, some treatment. So she had some tissue that was infiltrated with nerves, and the only real way was to operate. And she had the surgery, and she's had actually a series of procedures, but at the end of the day, she has the opportunity to be a person again. She can have intimacy, she can have relationships. I would love her to say the things that have happened to her as a result of all of this stuff.
Okay.
It's, I would say it's becoming a whole new you. It's, you've got this whole new body, and your self-esteem is so up. And not only is your self-esteem greater, your worry just dissipates, and you're able to be your full self. And having experienced the issues and then having conquered them is probably the most strengthening part of the whole experience, because I value that so much more in my life and in relationships as well.
Well, and I think what's an interesting thing is we opened up with 30% of younger women.
Right.
That's
quite
a lot.
That's quite a bit, and I guess I wouldn't have known that. And there's probably people at home who don't know that either, or are suffering with this problem. Is it only surgery, or are there other options out there in 2013 that are for these kinds of women?
See, that's the thing. I think there's a wide gamut of problems that people have, and that sometimes they're small and they can be quickly and easily addressed, but maybe people don't want to talk about them and they let them get out of hand, or there's not a lot of education on prevention of some of these problems.
Okay.
So diagnosis is the key, finding out what it's wrong. Hormones can work, physical therapy can work, many other things can work, and in this case she tried many of these things and it didn't work. But at the end of the day, the message here is, don't let this problem beat you down. Find help for this.
And what are those red flags? What was yours? When did you decide, all right, that's it, I've got to go get help? Was there something, did you wake up one morning and decide this? How did that all happen?
Well, I was experiencing pain and chronic inflammation for a while. It sort of slowly came on, and I just knew it was not normal. And it was a series of doctors and health regimes that I went through. And those things actually helped me discover, one of them was physical therapy, and I had bladder issues, and addressing those things actually helped me discover that I had, you know, a very, very extreme problem, that I was going to need surgery. By the time I got to Dr. Goldstein, I had been through so many doctors that that he pretty much, I'll never forget, he pretty much looked at me and was like, okay, you let me know when you're ready for surgery.
Yeah.
I think
you owe this man a big thank you, it seems like.
Yes, I think we both knew where the path was going to go, and so at that point it was just, you know, I've come this far. I'm not going to stop now. And then when I did have surgery, I made sure that I took care of myself very well, and I've done a good job of doing that subsequently and made it a priority in my life. And as a result, my overall health has benefited as well.
All right, well, before we wrap this up, let's talk about the future. Besides surgery, there's something else coming out.
Yeah, so this is 2013 is the year of the woman in our field, in sexual medicine, the year of the woman, because the FDA will likely release the first ever safe and effective drug for women with sexual problems. It's going to be pink in color, and we'll deal with women who have low interest, and that's going to come out in the fall. So we're very, very excited about all that.
Okay, well, thank you both for being on the show. To get in touch with Dr. Goldstein at San Diego Sexual Medicine, located at Alvarado Hospital, the contact information is linked to our website, and it's also right there up on your screen. All you have to do is click on the Scene On tab. All right, Raul, I'm going to send it back to you.
All right, guys, thank you. Good information as always.